So good afternoon, good evening, everyone. Please confirm you are able to hear me. Are you able to hear me? Hello? Hello?
You can.
Lucy? Lucy? Are you able to hear me?
Yeah, I can hear you.
Okay, but you seem to have a network that is going down. So I see we have 36 participants in the group meeting, and I feel like we need to start this session. Lucy, before I introduce you, I would like to ask you if you are able to project from your side your presentation, or should I do it for you?
You can do it for me, please.
Okay, that is noted. So today we are going to have our 8th session this evening. We are going to have a session from Lucy, Nyawira, and I want to welcome everyone on board.
I can't hear you.
You can't hear me?
Joshua, your background is noisy kindly.
Yes, it's raining. It's raining in my background. It's raining. So we're going to have our forum session facilitated by Lucy. Lucy is a project coordinator at the Safe Community Initiatives. And Lucy has experience in peer education in the SRH field and is a SRH Champion. So at this time, allow me to welcome Lucy to go ahead with the presentations. Lucy?
Thank you, Joshua. Okay, as Joshua had already introduced, my names are Lucy Nyawira Maina. Apart from being a project coordinator, I am also a student taking clinical medicine and surgery. So as for today, we'll be talking about antenatal care with the main focus on goals and principles of antenatal care. So it's just a short session, just 1 hour. So we'll try to make it as lively as possible, but I know I will impact you with knowledge. So please be prepared to note something down. And if you have any question, you can just type it on the chat box so that everyone can see the question, and at the end of the session, we'll be able to answer each and every question that you raise. So let's start. So antenatal care. What is antenatal care, first and foremost? You know, when you start a topic, you have to know its definition. And according to the American College of Obstetrics and Gynecology, antenatal care is a planned program. So it is a planned program. It has to be planned. Okay, so it's a planned program of observation, education, and medical management of pregnant women, directed towards making pregnancy and delivery a safe and a satisfying experience. So any antenatal care visit, it is planned, okay? And the nurses or the healthcare provider has to observe. She or he has to give a brief education about what the pregnant mother will be going through, and also there's supposed to be medical intervention in it. So antenatal care is also termed as prenatal care, and it's a type of preventive health care. And the aim of antenatal care is to ensure that the pregnancy causes no harm to the mother, and also to keep the fetus healthy during the antenatal period. So that is the main aim of antenatal care. And antenatal care, we have two types. We have the traditional antenatal care, and we have the FANC. It's called the focused antenatal care. So according to WHO, they prefer the FANC, that is the focused antenatal care, than the traditional antenatal care. And the traditional one was it started in the 1990s, that is, but in the year 2001, 2002, WHO was able to bring forth this FANC into the system. And in countries like Ethiopia, they use only FANC, and also Kenya, we use also the focused antenatal healthcare. So during our discussion here, I'll be mainly talking about the focused antenatal healthcare. So the next page. So the aims of antenatal care is to provide the pregnant mother and the partner, that is, after they go sick for the visit, they are able to know the possible complications or the risk factors that may occur at any particular gestation age. And antenatal care, as I had said, it's a program and it follows a definite plan. So it must be problem oriented. In the antenatal care, we identify the risk factors from the previous obstetric history. So when this pregnant mother or this expectant mother goes for, okay, she gets pregnant, she has the signs and symptoms of pregnancy, so she goes for the test, the pregnancy test in the healthcare facility. Immediately after being tested and being validated that this young mother or this old mother is pregnant, the healthcare providers start by identifying the problems that this mother is going to face during the pregnancy. And if this mother has any complication, these complications have to be noted down so that the healthcare providers have to take a clear, as in this healthcare providers have to have a clear guideline on what to look at this pregnant woman. So during the antenatal care, the fetal conditions are being checked at a repeated, and these fetal conditions are checked repeatedly. And when we're talking about FANC, that is the focused antenatal care, we have 4 visits, minimum of 4 visits. That is, this young mother, this expectant mother has to go for this clinic 4 times during the 9 months where she's pregnant. So during this antenatal care, the healthcare providers must ensure that this mother is given healthcare education. Okay, regardless of where this young mother or this expectant mother is knowledgeable or not. So the healthcare providers have to provide this mother with knowledge, with healthcare education. So these antenatal appointments should have a structure and a focus. So during the first antenatal care, the nurse, because most times when these mothers go for the antenatal care, the first people that they see are the nurses. So these nurses, they give out a structure, and mostly they give like a counseling session to these mothers, whereby they tell them at what time they should come for their appointments. They tell them what are the complications that they're going to face during their pregnancy. They are always given information about the danger signs and also the signs to look out during labor. And they are always given incorporated routine tests. That is, there's some tests that these mothers go through. That is, they are given tests on their blood pressure. They are given tests on whether they have malaria or whether they are HIV infected or whether they have hepatitis B or whether they have high blood pressure. These are the routine tests that these young mothers go through when they visit their antenatal health care. So what are the goals and the principles of antenatal care? You know, you can't just go to the hospital without a goal. You can't just go to the hospital and the healthcare providers, they monitor you without any principle. That is, so one of the goals that that are important or looked at the antenatal care is promotion and maintenance of physical, mental, social health of the mother and the baby by providing education on nutrition, personal hygiene, and the birthing process. So this is the first goal. This mother has to be physically healthy, has to be mentally healthy, has to be socially healthy. You know, when you talk about health, we are not only talking about the physical aspect, we are talking about also the mental and the psychological aspect or the social aspect of this mother. So first and foremost, this mother has to be healthy, and this baby has to also be healthy. And health is incorporated in the sense that this mother has to know which diets she is supposed to take. This mother has to know the personal hygiene, because you know some infections can be passed through the vaginal, that is the vaginal area. So this mother has to know what are the personal hygiene practices she has to take through. And this mother has to also understand the birthing process. You know, if this mother is a first-time young mother, birthing is it's stressful. It's stressful, eh? And if you have not given birth, you are always afraid of what next. You don't know. You have never experienced it. So the nurses and the healthcare providers have to always give you the birthing process. They tell you what is expected in the hospital, and just in case you're not able to reach the hospital and you're giving birth at home, what are the things that you should look at? Because we have seen us in scenarios whereby mothers give birth at matatus or while they are traveling. So these they have to be ready. They have to be ready for anything during their pregnancy. So another goal of antenatal care is to detect and manage complications during pregnancy. And these complications can either be medical, surgical, or obstetrical. So antenatal care, you are able to detect the complications this pregnancy has. Another aspect or another goal of antenatal care is to develop something called the birth preparedness and complication readiness plan. You have to be prepared. When you are pregnant, you have to be prepared. And in preparation, I'm not talking about aspect of financial, only finance alone. No, you have to be prepared psychological also. You have to prepare the members of your family. That is, if you have an extended family or you have your partner, you have to be prepared. And when you're talking about pregnancy, anything can happen during these 9 months. Anything can happen. So any complication can happen. You can have an accident, or let's just say by accident you have vaginal bleeding. You know, so you are supposed to be always prepared. And these are these aspects of antenatal care. The healthcare providers always give you information of birth preparedness. Another goal of ANC is to prepare the mother to breastfeed successfully. You know, you just can't wait for this mother to give birth. Then that's where you start training her on how to position the baby during breastfeeding. No, this happens even before this mother gives birth. So the nurses or the healthcare providers who are in the hospital, they always prepare these mothers on how to breastfeed. They are always given information about how to take care of their children when they are born, either physically or socially. Now, when I'm talking about goals, it's not different from when I'm talking about principles. When I'm talking about a goal it's ni lengo in Kiswahili. And when I'm talking about principle, it's what is behind these goals, what is behind this lengo, that is. So principle of ANC is to predict problems. You are going for this visit to predict a problem. And this problem during the ANC visit is predicted during history taking. When this mother goes for this visit, the healthcare providers, they take down history, either medical or social or obstetric history, or they do a physical examination whereby they check the abdomen, they check the respiratory system, they check the cardiovascular system, you know. So these nurses are able to detect if there is a problem. And if there is a problem, they are able to prevent or reduce the severity of this problem. Okay, so they first detect the problem or predict the problem, then they are able to prevent or reduce the severity. Okay, and during the detection, they are able to treat this condition. And this condition can be either harmful to both the mother or the fetus. So during the ANC visit, the nurses or the healthcare practitioners are able to detect and treat this condition. And apart from treating it, the healthcare providers will provide this mother with enough education and information and also reassurance, both the mother and the partner, on the pregnancy. So that is the principle in general. Okay. So when I'm talking about ANC, the current approach. So you are a first-time young mother, let's say. What are the things that you are expecting as a first-time young mother, and you're going to the hospital for an ANC visit? What are the things that you are expecting? Okay, the first thing you expect is a pre-pregnancy counseling. You have to be counseled. Okay, pregnancy is something wonderful because you're bringing a new life in this world. So, and it's something whereby you have never gone through it if you're a first-time young mother. So it's you have to be given counseling. And counseling, the pre-pregnancy counseling, it entails things like what to avoid during your pregnancy period, like smoking, alcohol, drugs. These are the things that you are told. You are also given the folic acid supplement, and these supplements you are given during the 6 weeks prior to conception. Okay, during the pre-pregnancy counseling, you are given a detailed view about your diet. What are the foods which you are supposed to take? Foods which are low in fat quantity, foods high in fiber. You are given a detailed prescription of the diet that you are supposed to take through. And mostly here, you are always taken to the area of the nutritionist. You are directed to the nutritionist, whereby they counsel you on the food that you need. And another aspect of counseling is you are given advice on the exercises. You know, when you're pregnant, you're not supposed to do vigorous exercises. It's harmful for the baby. So you are given the examples of exercises that you can do, such as the squats, the lunges. These are the examples of exercises that you can do. And Matthew, you cannot do this exercise without supervision. You're not supposed to do them alone. You have to be with your partner or with someone. You're not supposed to do these exercises alone. And another counseling you're told about, it's about the clothing. You're supposed to wear clothing that is comfortable for you. You are given benefits of why you should breastfeed after conceiving. You're given, some of us ladies, we don't want to breastfeed because we have myths and misconception about what we want our breasts to look like. But there are a lot of benefits of breastfeeding, and it's not only about giving the balanced diet to the baby after giving birth, it's also about preventing breast cancer, if I may add. So we're also given advice about coitus. There is not specific thing that you can tell to prevent coitus, but in some scenarios, according to your history, you can be given a brief of a short, like let's say you're not supposed to do it vigorously and that sort of thing. So another approach, when you go for the NC, you book visits, and this is ideally 10 to 12 weeks. And during your visit, you book for a scan. During the scanning, they are able to do like ultrasound. They're able to take your weight, your height. They take your blood pressure. They do a breast check. By the way, some ladies have something called the inverted nipples. That is the nipples, they get inverted. So they are supposed to be breast checks, and this is done by qualified nurses, that is. And they also do something called the abdominal examination, whereby they check if you have any pelvic masses. they check the fundus, the umbilicus. They do a lot of checks during this booking. They also take your blood sample, whereby they do a full blood count. They try to know which blood group you are. They test you for different diseases such as hepatitis B, syphilis, rubella. They do HIV serology. These are some of the things that they carry out during the booking after you have booked a scan, that is. So when, let's say by accident or by, let's say like, I'm not saying it's an accident or something. Let's say you are a negative. You have a rhesus negative blood group. It is not something bad. Yeah, it is important for them to check your blood group because you are able to be given something called the anti-D. And the anti-D is always given during the 28 or the 34 weeks during your pregnancy. So it is very important this blood group of yours is checked to prevent further pregnancies whereby you are not able to conceive because the baby dies in the process, that is. So the other aspect that they do when you go for the antenatal visit is something called routine antenatal visit. We know when you go for the antenatal visit, they take it as your first antenatal visit. And Matthew, if you remember when I started, I said that you're supposed to go for 4, minimum of 4. So they have to book you for the remaining 3. So they tell you the dates and the time where you are supposed to go for this visit. They give you something called antenatal education classes and inpatient care if required, that is. So what are the components of the ANC visit? Blood pressure measurement, they have to check your blood pressure. There's something called eclampsia and preeclampsia. So it is important for your blood pressure to be checked. They do something called the urine testing, whereby they test for your protein levels and your glucose levels in the urine. They do fetal growth monitoring, whether your baby is growing in the right height or the right weight, or the baby is growing too fast or too slow. That's what they do. You're always given something called the iron folic acid supplementation, tetanus vaccination, and you are always given deworming. And this is done in the first trimester, the deworming. Yeah. So during this ANC visit, they're able to detect complications such as hypertension and pregnancy diabetes. Okay, so those are the components of the ANC visit. So let's bounce back to something called the birth preparedness and complication readiness. So when I'm talking about ANC, this aspect of birth preparedness is important. Any expectant mother has to be prepared for any eventuality or any case of complication or any case of emergency during their pregnancy period. And when I'm talking about birth preparedness, I mean it's a process of planning for a normal birth. You are planning for a normal birth. And when I'm talking about complication readiness, I'm anticipating the actions needed in case of an emergency or in case of a complication. And when I'm talking about emergency planning, is the process of identifying, agreeing all the actions that is needed to take place quickly in the event of an emergency, and that the details are understood by everyone involved and necessary arrangements are made. So birth preparedness is the process of planning for a normal birth. So the healthcare providers have to help this expectant mother prepare for a normal birth. And if the healthcare providers see a complication, they have to help this mother prepare for any complication that is going to happen in case of an emergency. So birth preparedness is also called birth and emergency preparedness in the antenatal care. And those who have given birth, they know it's a very important aspect whereby the healthcare providers and the nurses, they sit the mother and the partner down and they take them through the danger signs that are going to occur during the pregnancy. And these danger signs, some of the danger signs include vaginal bleeding, blood vision, abdominal pain, and fever. And mostly this vaginal bleeding is where they stress most of their advice on. So during birth preparedness, you have to consider the useful and practical intervention. Okay, so in birth preparedness, it helps ensure that women can reach professional delivery when labor begins. Okay, you know, being pregnant and giving birth, you know, it's a process. It's a very natural process. So it's a natural. Okay, there's somebody who is up. Thank you. So pregnancy is a natural process. So this expectant mother has to be prepared psychologically, and this expectant mother, when she goes to the healthcare, she needs professional delivery. She has to have that satisfaction that her baby was delivered in a professional way. So birth preparedness ensures that these women can reach professional delivery when labor begins, and also it reduces delays. When this woman is told about the danger signs, you know, immediately she sees that she's spotting, or immediately she starts having abdominal pain or fever, she can immediately know that this is a danger sign. So she informs her partner, and immediately they go to the hospital. Okay, but if you compare a mother, an expectant mother who has not been given or being given advice on the danger signs or signs of labor, this mother won't know that me having a fever is something I have to rush to the hospital. You see, so when this mother is educated on the danger signs, she's able to know that this is an emergency. I have to take a taxi or any means of transport. I have to rush to the hospital immediately. And by rushing to the hospital, she's able to save her pregnancy. Okay, she's able to avoid delays during her delivery. So it reduces delays when the woman experiences obstetric complications, since it ensures the readiness and timely utilization of skilled maternal and neonatal health care. Okay, so birth preparedness can increase the use of skilled services. You know, when you have increased the skilled services, whereby the healthcare providers are able to give skilled services to this mother, you are ensuring that the baby being born won't have any complication. And some of the complications that arise are like cerebral palsy, okay, because of delayed things that are like delayed mini delivery. The baby will lack oxygen, then the baby gets paralyzed. But if there was immediate action, if there was no delays during the delivery, this baby would have been saved, this baby would have been delivered healthy. Okay, so it is very important for this mother to be counseled on the danger signs. So birth preparedness, it encompasses the process of planning normal birth and anticipating the actions needed in case of an emergency. It can be measured by the mother's knowledge on identifying the danger signs and the preparation to take measures during an emergency. So during the ANC visit, and mostly during the first and second ANC visit, ensure that this expectant mother is able to know the danger signs. So most times the nurses always ask these mothers, okay, I have already given you examples of danger signs. So mama, can you tell me what are the danger signs? So this mother has to highlight for you the danger signs so that you can ensure that she has really understood the importance of being prepared. Okay, so apart from these danger signs, this young mother or this expectant mother has to be prepared in terms of financial capabilities. She has to save some money in case of anything that can happen during the pregnancy period. You can't just tell me you are waiting for a delivery and you don't even have any amount of money saved just in case of let's say delays in let's say something happens like there's floods, you know, you need somebody to come and airlift you. That's cash. It has to be used. So you are supposed to always save. You have to save, because apart from that, let's say the public hospitals, there's a strike and there's no doctors. You need to take this pregnant mother to the private clinics, and in the private clinics, money is needed. So if this mother didn't have any money prepared, it will be a bit difficult to take this mother to the private clinics. Okay, so money is important. So when you are preparing the birth preparedness and complication readiness, this young mother, let me repeat myself, she has to know the danger signs. The skilled or the trained birth attendants have to be identified. Okay, you can't just tell me you are preparing to give birth and you don't know the facility where you want to go and give birth to. No, you have to go and know which health facility is suitable to you. Either the health facility must be close to you or appropriate in terms of closeness to your locality or residence. You have to identify, are these skilled trained birth attendants, are they knowledgeable on if there's any cases you've heard that in this hospital a lot of babies are die, you should avoid those type of hospitals. So you have to identify the trained birth attendants. You have to save money. You have to also identify the mode of transport. Let's say then the facility whereby you want to deliver is not close by. So you are needed to, let's say, find a taxi and get the number of that taxi guy. Ensure that this taxi guy is knowledgeable that you are expectant and your due date is this and this. Okay. And also, when you find the mode of transport, please don't find one. You have to have a plan A, plan B, plan C. Okay, because anything can happen. So make sure that you have 2 to 3 lines or numbers of any mode of transport. Another aspect of preparation, you are supposed to identify a blood donor. Anything can happen during this during delivery. You can lose a lot of blood during through vaginal bleeding, so you need a donor. So you have to identify the donor. Let's say the donor can be your sister or your relative or a close friend. So you have to identify a donor just in case of an emergency. Okay, so there's a lot of things that happen during emergency, and one of the delays can be caused by reaching a health facility. Let me give you an example. Let's say I am expectant. Okay, I'm at home, and I want to learn what are the delays that can cause me not to reach at the hospital at a fast rate. One of the delays as an expectant mother is deciding the medical care. Me myself, or let's say I myself can tell myself, okay, I'm ready to deliver, but I don't like that hospital. And I'm already showing danger signs. So me deciding to seek medical care is a cause of delay in getting emergency help. So me as the expectant mother can make myself get a delay in delivery. Okay, so in emergency preparedness, the expectant mother can be the cause factor. Okay, this expectant mother can be the cause factor, and most of the cause factors are in line with our tradition. Like here in Coast Province, most mothers or most ladies, they delay going to the hospital by telling themselves, okay, mi siwezi enda hospitali mpaka nimwambie bwana. Unaona? No, you get this mother bleeding at home, or this mother dying at a fast rate, or this mother getting a complication during pregnancy because she can't go to the hospital until she waits for the husband to come home so that he can take her to the hospital. Okay, so that's a delay. Another delay is reaching a health facility. When you live far away from the health facility, it becomes something bad, in the sense that when you live far away from the health facility and something, let's say an accident occurs, or your amniotic fluid breaks at random, you're not able to rush to the hospital and seek medical care. And most women who live far away from the health facility always have deliveries at home. So it is best you identify a traditional person who, a traditional birth attendant, just in case of situation whereby you are not able to reach the health facility. And also, sometimes you can rush to the hospital in the time needed, but the treatment you get in the hospital is poor. Okay, the people who are supposed to care for you, the birth attendants in the hospital, are not knowledgeable enough, or they're not competent enough to give you the proper treatment. And this can cause a lot of issues for your baby and you yourself. So, as I had earlier stated, WHO has recommended at least 4 antenatal visits. So I'm giving you a summary of my of what I have talked. I know I've talked a lot. So WHO recommends at least 4 antenatal visits. So please, if you're expectant or you know somebody who's expectant, please advise them to go for this visit 4 times during their 9 months. Okay, and the focus antenatal healthcare was recommended during 2002 by WHO, and it is a personalized care. Okay, if you differentiate between FANC and traditional antenatal care, is FANC, it focuses on individually, that is, it focuses on the pregnant mother and the partner and the family. Okay, other than the traditional ANC, which focuses on the mother alone. So FANC, it's all about personalized care provided to a pregnant woman, which emphasizes on the woman's overall health status. They check the woman as a whole, and during every ANC visit, they do a repeated test. So every ANC visit, they don't just go back to your old history or your old antenatal visit. So if you go for your second visit, they do the test again. If you go for your third visit, they do the test again, because they take you as already a risk factor as you are. So FANC will ensure that you are always prepared for any complication. They'll ensure that you are always educated and informed. FANC ensures that these pregnant women have simple and safe delivery during the delivery method. So there is somebody who had asked me about antenatal exercises, and it is important for women to do antenatal exercises because they provide physical and physiological well-being. You know, exercises are important, and they ensure that your pelvic region is able to push during your delivery. So you're supposed to do some squats, you're supposed to do some lunges, you're supposed to do some bridges, and these exercises will enable this mother to have a smooth labor, and also will prevent this mother from having any pathologies. That is, okay. That marks the end of my my session. But I know that I have a lot of questions that are in the chat box. So I know nimetalk sana. I'm sorry. Being a student, tumezoea sana kuongea. So if you have any question, I'm going to pass this through to Joshua as I'm going through the question in your chat box so that I can get the answer for them. Thank you, Sana.
Thank you so much, Lucy, for the presentation. I hope I'm loud and clear.
Yeah, I can hear you.
So allow me to go through the chat questions so that I can share with you. So I'm going to look at them, then you write them somewhere so that you can now answer them at once. I'm checking at the Facebook Live first. So let me look at the guys from the Facebook joining us live from Facebook. And I would like to appreciate those who are joining us from Facebook Live. We really thank you for joining us. We really thank you for your indulgence. We thank you so much for always ensuring that you join us from Facebook. And looking at Facebook, I see various people following: Zilpa, Villa Joy, Mildred, Irene Misau, Scania, Ogamigbo, Mary Cynthia Monica, Mary Vicky, Naomi, Peter Nelson, Michi Sean, Rebecca Williams, Jerry Waruguru, uh, Peter Nelson Chege, Felix Agola, Nancy Njoki. I'm not seeing a question from Facebook, so allow me get back to the Zoom platform. So I will start with the first question. And the first question is, that is from, the first question is, a must for an expectant woman to attend the clinic 4 times in 9 months? Is it a must for an expectant woman to attend the clinic 4 times in 9 months? I have seen nutritionist Sheila trying to answer that, but even Lucy will give us another trainer. She's saying no, she should attend at least 4. Irene Dole is asking, how does high heel shoe affect the fetus? How does high heel shoes affect the fetus? Jacqueline Uma is asking, under components, I know it's 2 doses of tetanus.
We can't get you well.
Mom. So I'm reading Jacqueline Uma's comments. She's saying, under components, I know it's 2 doses of tetanus for a first-time mom and 1 dose for other moms. Is HIV testing also a component? Jacqueline Uma is asking. Then how long is one supposed to convince after a fibroid removal operation? It's also appreciating the session. Ruth Ogola is asking, when should a pregnant mother start an NC visits? Then there's a question here. There's a question about when should a pregnant woman start a visit? Is it okay for a pregnant mother to go for COVID-19 vaccine? Then Lydia 10, are we still on the same planet? The only repeated tests are for HIV only, unless you complain of head arthritis. At how many weeks should one go for a scan, and scan should be done how many times? Then what cause muscle pull during pregnancy? Mine Gachao is asking, what can be added in the antenatal booklet so as to capture more men to fathers to at least accompany their wives to the clinic? Yeah, those are the questions. I think I'll get back to Lucy. I hope you noted them so that you can move and answer some of this.
Okay,
Welcome.
so thank you.
Back.
Okay, thank you, Joshua. So I'll start with Atola's question, whereby the question was, is it a must for an expectant mother to attend the clinic 4 times in 9 months? So I can see that Shayla said no, she should attend at least 4. So according to the Focus Antenatal Care, this mother should at least attend 4 visits. Okay, 4 visits, that is. So the first antenatal care visit is when this mother has already perceived that she's pregnant. Let's say you have signs and symptoms of pregnancy and you don't know if it's pregnancy. So you go to the hospital and the healthcare providers tell you, okay, you need to provide us with your urine sample so that we can check whether you are pregnant. So immediately they test that you are pregnant. They direct you to the antenatal care unit, whereby you immediately start your antenatal visit, and the healthcare providers schedule for you other visits, that is the 3 remaining visits at least. You know, when you compare with the traditional antenatal visits, here it was mostly, let's say, once per month. Okay, and they found out that it was tiresome. It was financially illogical, whereby this mother will be using a lot of finance to take herself to the clinic every month. Okay, or so they saw that at least if this mother comes at least 4 times, they are able to capture any complication or any detail about this mother, and this mother won't be burdened with any financial constraint. So it is advised this mother to attend at least 4. Okay, so Irene also added that, does high heel shoes affect the fetus? High heel shoe. Okay, it doesn't in a sense that affect the fetus per se, but when you're talking about high heels, when you're wearing high heels and you're pregnant, you are prone to have, you can fall down, hurt your ankle, and in the process you can easily fall down by your abdomen, and it can cause you to have you can rupture your amniotic fluid by accident because of that. So it is advised that women wear flat shoes, because pregnant women are prone to edema, okay, because of the weight of the fetus. So they are always advised to wear flat shoes. Okay, so I don't think there's any article written or investigated about high heels causing affecting the fetus. It's all about during when this mother wears high heels, she's prone to fall down, she's prone to accidents, and this can be very bad for the baby, that is. So we have Jacqueline Oma. Under the components, I know it's 2 doses of tetanus for first time moms and 1 dose for other moms. Okay, when you're talking about tetanus vaccination, we have to give at least 3 doses. You have to give at least 3 doses of the intermittent preventive treatment with sulfadoxine and pyrimethamine. Okay, IPTP. So this vaccination is 3 doses at least. Okay, at least 3 doses. That's what I know. Yeah. So is HIV testing also a component of NC visits? Is HIV testing also? Yeah, HIV is part of the scanning that they do during when they take your blood, whereby they take your blood for blood grouping and antibody screening. They also take your blood for full blood count. They also take your blood for hepatitis B, for syphilis, for rubella, for HIV serology, and in some scenarios, according to your past history, they take your blood to do some testing on sickle cell. That is, if you have the sickle cell antigen. So it's important for them to do the HIV serology for you. So it is part of the component in NC visit. So Wanjiku Kimani, as she is asked, how long is one supposed to convince or conceive? Okay, she didn't convince, conceive after a fibroid removal operation. How long is one supposed to conceive after fibroid? Okay, in fibroid, when somebody has already been undergone the fibroid operation, it depends with what the gynecologist tells this mother. So when you go for when you've already been removed your fibroids, you go for the visit, let's say the inpatient visit, there is some advice you're always told in terms of how when they carry out your body test, when they take your blood pressure, they do a scanning of your pelvic region. There's some advice you're given, and also it depends on on if the type of fibroid you had also. When the fibroid you had during the operation, they had to remove like a part of the uterus. Not when you don't have most part of your uterus, you're not able to conceive. So I think here, fibroid removal, it depends on the operation that you had undergone and the type of fibroids that you had and your body's physical well-being as a whole, that is. So when should a pregnant mother start an ANC visit? Immediately this woman knows she's expectant. Immediately she finds out that she's pregnant or she has the signs of pregnancy, she's supposed to first start a ANC visit. Okay, so immediately. Okay, so under components of preparedness, a mom needs to register for NHIF or take Linda Mama. It's really helpful. Buying baby clothes. Yeah, these are when I was talking about birth preparedness, when I was talking about complication preparedness and emergency planning. This expectant mother has to consider birthing supplies, and most of the supplies that she has to consider is does she have very clean clothes? Does she have the emergency surgery pack, or does she have a very clean razor in terms of when this mother is in the rural areas, that is? And this mother has to, when she goes for the ANC visit, the nurses, they always advise her to take Linda Mama, and this is found in the public hospital, or she has to have an NHIF cover just in case. Okay, so she has to buy clothes for the baby. She has to have clean towel or a lasso. She has to be prepared with the buckets. She has to have the cottons, that is just in case. She has to be ready. She has to have soap. Okay, she has to have surgical spirit just in case. So these are some of the components she has to have during birth preparedness. So is it okay for pregnant mothers to go for COVID-19 vaccine? Okay, according to right now, if you are conversant with the news that are going on in Kenya, we expectant mothers right now are okay. Me as a professional clinical officer, I advise not to have the COVID vaccine when you're pregnant for the time being, or wait for your delivery, then you can have the COVID-19 vaccine. So, because there's some people, they face different when they get the vaccine. Like I myself, when I took it, when I was given the jab shot, I had I had blurry vision. I felt tired in my knees. You know, these effects of the vaccine can be very bad for pregnant women. That is, if what I felt, and let's say I was pregnant, I don't think it would have been good for me as an expectant mother. So at how many weeks should one go for a scan? And scans should be done how many times? Scans mostly are done in the second and the third visit. The scanning, either the second or the third, and this is done when the healthcare provider or the birth attendant wants to know whether the fetus is in the correct position, or whether there is any complication, or just in case you have an hereditary condition in your family and they want to check if this fetus is healthy. And another reason why you can do the scan is when you face the danger signs. You know, that's where they take you for the scan, and mostly scans are not X-ray. X-ray are bad. Radiation is bad for the baby, so you're going you're not going for the X-ray, that is. So when you're taking the scan, it's during the second and the third visit. That is mostly where you are taken for the scan, that is. So what can be added in the antenatal booklet so as to capture more men and fathers, at least accompany their wives to the clinic? So far that I know about, the funk, that is when you go with your husband or your partner during the NC visit, you are allowed to cut the line. I think that's what they use to encourage more fathers or to encourage more men to bring or to accompany their wives during the clinic. So they mostly don't funga that long line during the NC visit. When you have your partner with you, you just go straight to the healthcare provider. Okay. Okay, somebody, Eunice has said, kindly share some of the strategies we can use to improve male partner involvement, especially during the ANC and also as a birth partner. You know, it is this FANC, the focus antenatal care, it focuses mostly on the mother and the partner. Okay, it doesn't focus on the mother alone. So the expectant mothers are always advised to bring their partners with them during the NC visit at least once, so that they can be educated during the pre-pregnancy counseling or the antenatal classes. So during these antenatal classes, here it's whereby they are given the information, or they are given the birth preparedness, they're given the complication preparedness, they're given the emergency planning during when they come with their partners during the NC visit. So for those who have taken the initiative to bring their wives or their expectant wives with them during the NC visit, they know that they are always cancelled. Okay, and most fathers, they always ask a lot of questions compared to the expectant mother. So they are always advised to bring them. So I'm sorry that I wasn't able to show the booklet, the antenatal care card. I would have showed you so that you can see the components that are in line. But I know that I will send a copy to Joshua, and he's going to show you guys. So there's somebody who has asked, are different clinic books for HIV positive mothers, or is it just the same purple booklet? Okay, you can't differentiate booklet for HIV positive mother. You know, that is like you're stigmatizing them. You're giving them a label. Okay, their own book, you're like stigmatizing them. So any expectant mother is given the purple HIV positive mother or a hepatitis positive mother. Okay, so they're given the same booklet. So why do fibroids in uterus reoccur even after operation? They can reoccur by the fibroids, and as I had said earlier, it depends on the type of fibroids that you have, and it also depends on the position the fibroid is growing from. Okay, so if a pregnant mom gets sick, can she go under medication? Okay, medication has to be in line with what the healthcare provider issues. You're not supposed to pre-medicate yourself. You're not supposed to give yourself medication. You're supposed to seek healthcare advice from the qualified nurses or the healthcare providers, that they're ones supposed to tell you which medication to use, which doses are important for you to use. You're not supposed to just medicate yourself. But there's some medications that can be given when you have any medical condition such as malaria, but the doses are they're not high, because drugs are bad for the baby. They cause the baby to be deformed or have different let's say the baby can be born with let's say with the mental degradation, you see. So there's some medications that are not supposed to be given to pregnant women. So these women have to seek medical advice before they take this medication. So what causes hyperpigmentation during pregnancy, and how can one treat it? Hyperpigmentation. Hyperpigmentation, you know, when you're talking about hyperpigmentation, it's hyper. When I'm talking about hyper, it's high, and pigmentation is when you have discoloration or on the skin. That is, it can have a lot of effects. You know, the first thing is your genetic makeup. Okay, your skin tone, and there's some diseases that target the melanin, and hyperpigmentation, mostly with those conditions that target the melanin, they can cause you to give birth to a baby who is not having the same tone of pigments that you have. Or hyperpigmentation can be hereditary in the sense that in the line of the father's genes or in the line of the mother's genes, they have that hereditary condition of hyperpigmentation. So it is really, is it really the responsibility of a pregnant woman to find a donor? How feasible is this? I thought that this should be the role of the doctor and or midwife attending to the pregnant women during ANC. So, Eunice, when we are talking about the donor, you know, blood, anything can happen during when you need blood. Just in case you have an accident or you have a vaginal bleeding and you are in dire need of blood, you can be told that in the hospital that the blood bank is far away or the blood is on its way, you know. And during emergency transfusion, you need blood, and it takes a lot of time before you are transfused. Anything can happen, and you can lose the pregnancy, or you yourself can die. But if you are prepared yourself during when I was talking about birth preparedness, when I was talking about complication preparedness, when I was talking about emergency planning, when you already have a donor identified, when you already have a donor, let's say your friend or a relative, you know this relative of mine is O negative. So in case I need blood, he or she is available to help me with her blood. Okay, no, you're already prepared for an eventuality, other than you going and waiting for them to give you blood. That is, anything can happen. Let's say the blood has already been used, there was a surgery. You know, we are dealing with assumptions, and during your pregnancy, you're not supposed to assume a lot of things. This is your pregnancy, this is the life of your baby, this is your life, so you're supposed to always be prepared just in case. Okay, Eunice. So it is safe for a pregnant woman to engage in sex during her last week of delivery due date. Okay, while I had already talked about coitus, that is sex that is during pregnancy, I told you there is no written document about when it's suitable or when not to do. It's all about how vigorous you do it or which medical condition the pregnant mother has. Okay, if the pregnant mother, let's say she has a high blood pressure, let's say eclampsia or preeclampsia, or she has a diabetes, or she has these underlying conditions, doing something vigorous such as coitus or also exercise can raise her blood pressure. Okay, it can raise her blood pressure, and that is bad for her and for the baby. So when you're talking about engaging in sex, you are supposed to be safe. That is, you're not supposed to do it vigorous. It's not supposed to, let's say at a last week of delivery, you know, it's you can she and her partner can engage. Even she can do it during her, let's say she's remaining with 1 day to her delivery. She can. But is it safe? Is it vigorous? Is it comfortable? Does she have any underlying problem? Huh? Those are the factors that she has to take through when she engages in the coitus, that is. So once one can have sex until they go in labor. Yeah, the issue is comfy and the two are involved. Yeah, this is my take also, Eunice. So even if I'm going to deliver today or tomorrow, I can still engage in sex if I'm comfortable enough, if I don't have any underlying issues, if I'm not vigorous enough. Okay, if the position that I'm doing is safe. Yeah, so those are my take on it. So when should a first-timer mom with negative rhesus factor receive the anti-D? And is it dangerous for the unborn if she can't get it? So the first time, as I had said about rhesus negative, when they take for your blood when they do booking for blood, that is, they take for blood group and antibody screening, they always do they do rhesus negative titers detector. They measure your whether you are rhesus negative or rhesus positive. That is, and it's mostly measured helpful during the 30 to 36 weeks. And here they give you anti-D. Immediately they know that you are rhesus negative. They give you anti-D, and they give you at 28 weeks and also at 34 weeks. Okay, they do it at 28 weeks and they also give you at 34 weeks. So they do that. So, and is it dangerous for the unborn if she can't get it? No, right, when it's her first pregnancy, it's not dangerous for the unborn baby. But if this woman is not given the anti-D, and at least after, even if she's not given during her pregnancy, she can also be given before 72 hours after giving birth. Immediately she gives birth before 72 hours, she's supposed to be given the anti-D. Mark you, if this lady is not given the anti-D, she is not able to conceive a baby because she will already develop antigens against the future babies and Nini. So see, if this baby is not given anti-D at 28 weeks or at 34 weeks, or after this mother delivers before 72 hours, this mother will have antigens. That is, she will have antigens against, she will produce antibodies against antigens against this baby's cells. That is, so when she gets pregnant, her second pregnancy, and the baby has let's say she's O negative, and she gets a baby, let's say O negative also, she will develop the baby will develop antibodies against the anti-Ds that she has in the system. So she's supposed to be given antibody at 28 weeks, 34 weeks, or before 72 hours after giving birth. She has to. It is very important. Or if she's not given, she's not able to conceive again. And this is bad. So one can have sex until they go in labor. Oh yeah, that we have already explained. So during your ANC visits, ensure that the doctors have done a blood screen for you. Ensure that you know your blood group. It's very important. Ensure that you've done you have done antibody screening. Ensure that the doctors have taken a test for HIV serology. They have taken a test for rubella. They have taken a test for syphilis. They have taken a test for hepatitis B. It is very important for you and your unborn baby. That is, ensure that you've booked for a scan. Okay. Ensure that they check for inverted nipples. It's something small. Ensure that they have done. They have taken your blood pressure. Okay. Yeah, those are the most important things when doing the ANC visits. That is. Any person with any question apart from the ones listed in the chat box?
Thank you so much, Lucy. I'll request anyone with a question to also raise their hands during the process. Any questions before we end up this communications, this conversation today? Let me look at the ones on Facebook. Unfortunately, there is no question from Facebook, but we really appreciate the people joining for the discussion today. We really appreciate your time for having us today for this meeting. It has been a great one-hour discussion. I thank you so much, Ms. Nyawira, for taking us through the discussion on goals and principles of antenatal care. And also, we have been discussing about pregnancy And now today we are discussing about ANC clinics. I've seen questions coming out, but this really needs to come out very good, and we are good to go. The next thing we need to ask ourselves is how do you want to involve ANC affairs to also ensure that women, there's scope the women getting ANC services. At this juncture, I would like to call upon if there's any questions, can you please raise up your hands before we end the meeting. So for the training, for the session presentations, we'll get them through the Google Classroom. And even the recording for this session, we also get them through the Google Classroom because some people didn't join us today. We were at 55 and now we are at 42. We say thank you for your indulgence and thank you for your time this night for having us within this discussion. I see comments at all. I say thanks so much for the discussion and within teaching. Dennis is saying, oh yes, it was quite interesting, engaging and informative session. Thanks a lot to our facilitator, Moderator Joshua Katina. That's very one. Thank you. Thanks for the nice session too. We appreciate your time and we appreciate having you every time and now. So as agreed, every Tuesdays we'll be having the quizzes for the two sessions. That is the session 7, the one that we had on concept of family, and then this session. So before next week Thursday, everyone should have done the quizzes, so that when we start the session 9, then you have done quizzes for session 7 and 8. That every Tuesdays we'll be having them. Tuesdays up to Wednesday, so you do them Tuesday, between Tuesday and Wednesday, so that on Thursday when we do the next session, already everyone have done the quizzes. Then for the next session will be on Thursday. We'll communicate on Tuesday about it. Between Tuesday and Wednesday, we'll communicate about the session and about the next facilitator as well. Then we will ensure that we share the sessions toolkits in the Google Classroom so that you check. So for the Google Classroom, you check them at your own time so that you don't have time of complaining a lot about data. So for us, if you want to get the resources for these sessions, please visit the Google Classroom at your own time. I don't have much to say, but just to thank everyone. Yes, I agree with Eric. It was a good presentation on a good topic. Many of our women ignore these visits. Thank you. And I hope you are going to encourage them to go for the ANC visits. Thank you. I want to allow everyone to mute. Then